of us take for granted, but for some, mental disease presents daily challenges. And here to talk about one mental disorder during this Mental Health Month is Dr. Clemmie Palmer. And Dr. Palmer, thanks so much for stopping by today.
Thank you for having me.
We sure appreciate it. We're going to talk about schizophrenia today. Just tell us what it is and what percentage of the population suffers from it.
Okay, schizophrenia is a psychotic illness. Manifested itself by delusions, which are false fixed beliefs, and hallucinations. About 1% of the U.S. population suffers from schizophrenia.
So is schizophrenia synonymous, or is it psychosis?
It's not synonymous with psychosis, because a lot of things can cause psychosis, like drugs, major depression, but psychosis is a major part of schizophrenia.
And how many episodes occur annually with symptoms of schizophrenia?
Right, about 300,000 episodes occur annually of schizophrenia.
So that's quite a bit.
A lot.
That's not something that you would really think is, common, and I don't know if you would consider that number common in people, but it kind of surprises me that it's so many.
Right.
The symptoms of schizophrenia can be classified as positive or negative. Explain that.
Positive symptoms are what we call very loud symptoms, very fast talking, loud speech, hallucinations. And the negative symptoms are more like quiet symptoms, real quiet, depressed type schizophrenic patients, little language, real soft speech.
So you hear people, or at least I've heard of people who have schizophrenia they hear voices and people talking to them and people telling them to do things, or the voices telling them to do things. Would that be one of the things that you're talking about? Yes,
that's one of the positive symptoms. They seem to respond a little bit better to medications than the negative symptoms.
And you mentioned medications. What are some medications or treatment options for people who suffer from schizophrenia?
Right, medications, I start there first. A lot of different medicines out now is Prexor, Risperdal, the antipsychotic class of medication, Seroquel, and individual supportive therapy can also help schizophrenic patients.
So let's go back just a little bit. Are there certain areas of the brain that produce schizophrenic symptoms?
Right. The main area we think causes schizophrenic symptoms are the area from the midbrain that projects to the limbic system, which is part of our emotional part of our brain, because that's the area where the dopamine we think is increased more to cause schizophrenia.
Is a mental illness like this, is it something that runs in the family?
There's a genetic linkage, I think, with schizophrenia.
Would it be more, if you see it in your family, is it something that you need to be afraid of developing? Is it something that you develop or that you always have? How does that work?
Right. We tend to look at it from a two-hit hypothesis. There's a genetic predisposition we feel for schizophrenia, and also there's an acute stressor that occurred, maybe the loss of a job or a separation, something tragic happened and make the symptoms come on.
Now, would your symptoms actually come on, or would it be something that you've always had and it's just that triggered?
That's a theoretical question. I like that. We tend to think they've already had maybe a mild form. It just didn't display itself overtly.
All right. And is there anything that you can recommend to folks out there who maybe haven't been diagnosed, might think that they have it? What should they do?
Just get regular general exams, just like they see a regular physician once a year, maybe see a psychologist or a psychiatrist once a year for a general checkup.
All right, Dr. Clemmie Palmer, some good information today. Thanks so much for stopping by. We sure appreciate it.
Thank you.
And we want to remind you about your opportunity to ask a doctor a question each Tuesday here on WNCF with How